Have you ever wondered why blackheads on the nose are so difficult to clean? To address this issue, we first need to understand how blackheads form. Blackheads are a type of open comedone, formed when a mixture of sebum, dead skin cells, and bacteria clog the pores. Sebaceous glands are located within the hair follicles and primarily function to secrete oil, keeping the skin soft and elastic. When sebum is excessively secreted, especially due to lack of sleep and an unhealthy diet, it mixes with dead skin cells and clogs the pores, forming closed comedones, whiteheads. If these whiteheads are exposed to the air, the oil oxidizes and turns black, forming blackheads. Additionally, some people may notice fine hairs on the sides of their cheeks that resemble blackheads, known as vellus hair. These vellus hairs look similar to blackheads, but upon closer examination, they resemble tiny hairs, sometimes with split ends. It is particularly important to avoid squeezing blackheads with your fingers. The nose is located in the danger triangle of the face, where blood vessels are directly connected to the face and brain. Any infection in this area can spread through the bloodstream to the intracranial region, leading to severe infections. Improper handling of blackheads can result in the formation of a strawberry nose, and in severe cases may require hospital treatment. To effectively deal with blackheads, it is recommended to use gentle methods, such as using blackhead removal products, maintaining good hygiene practices, and adjusting your diet and lifestyle to reduce sebum production and prevent pore blockage.